Good afternoon, everyone. My name is Jennifer Reeder. I'm the Director of Educational and Social Services with the Alzheimer's Foundation of America. On behalf of AFA, I would like to thank you all so much for joining us today for our webinar, Managing COVID-19 Special Issues Facing Families Affected by Alzheimer's Disease. So we find that this webinar that we're going to be giving you today is a very timely and important topic that we hope that will teach families how to be able to support a loved one when it's suspected that their loved one has COVID-19, what to do if there is a diagnosis, how to support an individual when they're trying to recover, and also the importance of vaccination. Our guest speaker today is Dr. Allison Reisse. Dr. Allison Reisse is a member of AFA's Medical, Scientific, and Memory Screening Advisory Board. She is also the Associate Professor of Medicine at the NYU Long Island School of Medicine and the head of Inflammation Laboratory at the Biomedical Research Institute of NYU Langone Hospital, Long Island. So we're going to start the presentation with a video that was recorded by Dr. Reisse. And then after the video, Dr. Reisse will hold a Q&A session. So I highly encourage you all that at any point when you have a question, either during the video or after the video, that you go ahead and type your questions in. Dr. Reisse will try and get to as many questions as she possibly can. And I always will highly encourage you all to reach out to AFA Helpline that's staffed by all licensed social workers who are there to answer your questions 7 days a week. You can reach them by either calling 866-232-8484 or chat through our website at www.alzfdn.org. Thank you all again for joining us, and thank you, Dr. Reisse.
Hi, everybody. I want to say how much I appreciate all of you coming today to this webinar and listening to this presentation. I hope it's helpful to you, and I'm standing by to answer your questions, and I'm excited to be able to do that. And enjoy the video, and we'll talk soon. Hello, this is Dr. Allison Reese from NYU Langone Hospital, Long Island, and NYU Long Island School of Medicine. I'm a member of the Alzheimer's Foundation of America Medical, Scientific, and Memory Screening Advisory Board. And I'm going to talk to you today about COVID-19 vaccination and managing COVID-19 infection in Alzheimer's disease patients and caregivers and the special issues involved with this population. So I want to talk about the specific concerns of COVID-19 for persons with Alzheimer's disease. One of the first hurdles, which is very important, is how difficult it can be to diagnose COVID-19 in persons with Alzheimer's disease. One reason is they may not be able to communicate symptoms to tell you that perhaps they have headache or body aches or other symptoms that are not visible, and they can't let you know that they're in pain or discomfort. Another problem is that many older people do not mount a good fever response. So even though one of the key hallmarks of COVID infection is a fever, these patients may not have that fever. Another problem is, again, a hallmark symptom of COVID is the cough. And many older people may already have some kind of chronic cough, or they may not have a strong cough and you may not notice the cough. They also can't tell you if they've lost their sense of taste or smell, which is another very important key indication to alert that COVID-19 may be the diagnosis. Another big problem in the elderly population with Alzheimer's disease is that even though they are the population most vulnerable because of age and other medical problems to becoming more severely ill with COVID, they're also less likely to be cooperative with mask wearing and hand washing. So these two key steps that we take to prevent the spread of infection may be very difficult for persons with Alzheimer's disease to accomplish, to keep the mask on consistently and in place, and to do these repeated hand washing. Also, by the very nature of perhaps not being able to do a lot of activities of daily living on their own, they may need a lot of physical contact and assistance from caregivers. So we can't keep social distance like we might wish with people with Alzheimer's disease, because we have to be there to help them. And of course, as I just said, because of being generally in an older population, the age itself is an increased risk, as well as the possibility of having a lot of other illnesses that go with age, including high blood pressure, diabetes, obesity, asthma, chronic obstructive pulmonary disease, and a history of cancer. So these are all problems that are of concern in general, but specifically in this population may be more amplified. So what are the challenges for the Alzheimer's disease patients and caregivers? I'm going to go through them one by one. Which one is, how do we care for these patients if they are suspected of having COVID-19? What do we do once the diagnosis is made? And how do we help with the recovery of these patients from COVID-19? So first, if a person with Alzheimer's disease is at home with COVID-19, some of the big problems we see are one conundrum that is not just for the older people, but if you think you have COVID-19 and you want to get tested, there are obstructions to getting tested. One big obstruction is that you're too ill and weak to go out to get the test. Another is that even if you are feeling up to getting tested, you don't really want to go to a test center and spread COVID-19 in a test center. So a solution to this problem is home testing, but unfortunately, we're not really seeing this roll out in the timely manner. And I think this is a very urgent need to get home testing so we can know if someone does or does not have COVID-19, because it is so important to know as we are trying to keep track of cases and trying to stem the spread of infection. I mentioned some of these other things before, that a person with COVID-19 often has headaches and body aches and general terrible discomfort, and they're restless. And if a person has Alzheimer's disease, they may not be able to tell you how uncomfortable they are. You may not really know how much pain they're in. They may not tell you if they're short of breath. They may not be able to express that. People with COVID sometimes describe it feels like they have a band around their chest, or they can't catch their breath. And older people with Alzheimer's may not be able to tell you that. Another thing is that when people have fever and chills and feel generally unwell, they lose their appetite. But with COVID-19, there's a compounding factor, which is the loss of taste and smell. So when on top of feeling ill, the food tastes like sawdust and nothing tastes right and nothing is pleasurable to eat, this is a difficult time as far as getting nutrition and hydration. So what do we do if we have a diagnosis of COVID-19 in a person with Alzheimer's disease? So we need doctor supervision, but yet we're told not to come into the doctor's office. And one of the problems I have seen is so many people who may have been diagnosed or suspect they have COVID-19, and they don't know what to do, because not everybody can pick up a phone and have access to a doctor, or has a doctor in place easily to reach, or a healthcare provider. And I think this is a systemic problem that we are going to need to deal with, that when people have come down with this illness, they need to know where to go. So I personally have gotten calls and communications and requests for help from people as far away as Georgia and New Mexico and California. And so people all over are facing this problem. So one of the solutions is telemedicine, is seeing your doctor on the screen or on a tablet or on a laptop or on a phone. But, you know, a lot of older people are not well versed in these technologies and don't know how to do this and to navigate this. And I myself have had a learning curve just to be able to do this kind of a lecture, to be able to communicate to you with technology, learning how to use all these platforms. I had to ask for help from our Long Island School of Medicine. When I'm at home, I ask my children. Young people just kind of do it naturally, but a lot of us have to really work at this. The next thing is that many people don't need to go to the hospital. We don't want them to go to the hospital. We want to be able to take care of them at home. But as I keep stressing, it's really difficult to know how ill they feel or to monitor them to know when they need to go to the hospital if they can't express it. And so one of the most excellent ways to measure the lung function and ability to get adequate oxygen is a machine called a pulse oximeter. And I'm going to demonstrate how to use it because I'm also hearing from many people that they don't know how to use it, or they haven't heard of it, or they heard about it, but they're not sure what it is. So I want to show this to you, to tell you how to use this little machine to give you very, very incredibly valuable information about how well someone is saturating their body with adequate oxygen in the blood. And they're not expensive, but again, not expensive is relative. Maybe some people would find that $25 to be an onerous burden, and we need to be able to get these machines out to people who need them. They're available in pretty much every drugstore. They're very easy to get, but you have to know they exist and know where to find them and go and get one, because it's so crucial to have it if someone has COVID. And then, as I said, we need to know how to use it. The very simple rule is that if oxygen saturation, the percent of oxygen in the blood, falls below 90%, then that is a signal to go to the hospital, to contact your healthcare provider and to get to the hospital for help. We also need to make sure that fluids and nutrition are adequate. And as I've said, it's very hard to get people to eat when they don't feel well, but at the very least, they need to drink, they need to have some electrolytes, a little bit of calories and nutrition from liquids. Another issue at home is if you are ill like this, you don't want to get out of bed. And that's a danger, because staying in bed a lot can lead to blood clots and other problems with that exaggerate the problem of bleeding if you end up with clots in the lungs. So there may be a need for some kind of anticoagulation, meaning, keeping your blood from clotting, be it just aspirin or other medications that, again, needs a doctor to guide you as to how to do these things. So I wanted to demonstrate the pulse oximeter, and I'm going to do that now. It's a quick, non-invasive, and completely painless test, and it's just so informative. So let me switch to show you myself on screen. So now I'm going to give a live demonstration of how to use the pulse oximeter. And as I said, you go to any drugstore and pick one up. It comes in a box like this, and any brand, I would not recommend any specific brand, but whatever your local store has. It comes in a nice little carrying case, usually, that comes with it. And it's just this incredible little device that is so powerful. And we used to have to actually use very invasive procedures to do this in days past. But now all we do is we put a little battery in. It takes a battery in the back, and then you're good to go. You put in the batteries and you open it up and you stick a finger in it. So you could pick whatever finger you like. You put your finger in, your finger fits in nicely and snugly, and then you press the little on button. It's just like any computer has a little on switch, and it takes a minute or two, and it's going to give me both my oxygen saturation and my heart rate. So my oxygen saturation is 98, 97, 98, and my heart rate. So that is so helpful. Now, oxygen saturation, 97, 98, anything like that is perfectly good. And then, as I said, but if it goes below to 90 or below, then you have to worry. And you can just do it as many times as you wish, and it's just so convenient and useful and easy. And that's why I wanted the audience to see that, so that I think you would be very comfortable with this. Of all the technology that we have, that one is, I think, pretty good and easy to learn. So now I'm going to switch back to my slides and finish up the slide presentation. So now we're coming to the light at the end of the tunnel, the recovery. And I hope you all know that recovery is possible. People of every age get through COVID and they come out the other end. In general, mild cases appear to recover within 2 to 4 weeks, and sometimes even less. Most everybody gets their sense of taste and smell back. A lot of people worry and are afraid that they won't ever enjoy food the same way again, but almost everybody gets it back. I want to say that the time period of worry is about generally a week into having COVID. That's when you kind of usually turn the corner to be better or go down kind of rapidly and then need more care. It's just a general rule, but it could be different for everybody. Of course, we're all, I think, hearing about some long-term lingering problems with COVID, people who recover overall, but they don't quite feel the same. They complain of brain fog, or they continue to have shortness of breath. You can have heart problems and lung problems. So those things are under study, and we're trying to figure it out and to help the many people who do have the lingering problems. But most people really do get better and come back to normal. Again, it could take up to 3 months to get your sense of taste and smell back. It's very variable. So we have to be vigilant with people with Alzheimer's disease, especially that their appetite may be poor. And we want to try to get them to eat and drink and find foods and drinks that they will be able to enjoy. I think soups go down well, and, kind of eat foods that are easy to digest. But you have to pick on the individual person on what they might enjoy. And we know that people could be very tired. Their bodies have been through a lot, having had COVID, and people who are fatigued and older tend to not be very active. So again, that danger of blood clots continues, and we need to do more research on all these things. But in the meantime, encourage exercise to the level that it's tolerated. When a person is over COVID and out of quarantine, we want them to get some sunlight and vitamin D. Either vitamin D is always good, either in food or, if necessary, the pills and from sunlight. And again, good nutrition and hydration and social interaction. Any person of any age or stage of life, we need social interaction. If we can't because of quarantine, then doing it online, on computer, on social media accounts, on Zoom, on WebEx, any of those ways is better than not having it. And then as people recover, they can go out for walks and they can do more things. They're always continuing to mask, continuing to keep social distancing and hand washing. But again, we can return to more of our pre-COVID activities as we see a recovery. Now, what about the caregivers? So when people have Alzheimer's disease, they often need some care. And if you're not the spouse or a person living in the house with the Alzheimer's patient, it really is good, if you're coming in from the outside, to mask. Also, caregivers also may fall into that older age group and have medical problems that can make them have a higher risk for severe COVID-19. And I mentioned some of those before: hypertension, obesity, diabetes. So we want to get the caregivers vaccinated as well. You may do temperature check for caregivers before they come in to monitor for fever. And as I said, always keep up that hand washing, social distancing, and minimizing outside exposure. I know everybody's heard that over and over, but it's no less true. But we're not able to live in a bubble. We all have to live in the world and do our best to do these things, knowing that all these months, we have to have also realistic expectations and do the best that we can. The vaccines. So we have a lot of issues now with the vaccines, which the efforts are there to get it out, to mobilize, to get it to people over age 65 and people with a lot of other medical risks. But we need to improve this access. I hope we can get to the point where we can vaccinate at home for so many people who would find it very difficult to go to these centers to get vaccinated. I think we need to recognize that asking older people or their spouses or their caregivers to use technology to book appointments is not ideal. It can be so frustrating. You know, you hear stories, people are trying and trying, they can't get anywhere. You have to persist. A lot of people ask their children to help them, but it's very, very difficult to navigate these technologies and get these appointments. And I hope that it's going to become easier. I hope we're going to mobilize helpers in the community to help the older people get the vaccines and get it efficiently and get it into people who need it, and especially the vulnerable, the ones who are most likely to have a poor outcome. And we have our stratifications, but clearly older people have a great vulnerability and are on that list. Then we have vaccines that I think are in the pipeline, and I'm hoping they're going to be coming soon. AstraZeneca and Johnson & Johnson. So we're waiting for those to be approved, and then that should give us more vaccine. And I want to say that if you need help, the Alzheimer's Foundation of America is a wonderful resource. We have the helpline, 866-232-8484. And we also have many ways to connect, as you can see here, that we have people to turn to if you don't know where to go to get help. We have people who will advise you. And we also have wonderful programs for people who are in quarantine or isolated, where they can see videos and watch musical performances and participate in exercise and other things to, you know, kind of forestall the loneliness and the isolation. So I urge you to not hesitate to call for help, and to hopefully take all of the information here and use it to get through this bad time, and to either get to the point of vaccination or get through COVID if that happens. And we did our best, and we know some people are going to get COVID because it's out there. So I want to say I wish the best to everybody, and thank you for listening, and I hope this was helpful, and we will talk again soon.
Thank you so much for that extremely informative video. I know we all greatly appreciate that. We do have some questions whenever you are ready, Dr. Reese.
I'm here and I'm ready to take questions.
Okay. So we have a question. Someone's asking about, will the vaccine be offered to homebound individuals?
Well, I think I tried to address that. You know, I don't know how they're going to work this. All the logistics, you know, are not in my control, but I think that is so important, and I think we need to do that. I don't think it should be that difficult to figure out a way. So my answer is, I hope so, but you know, our audience here is all over the country, and I guess each individual community is going to figure these things out and figure a way, I hope, to do that.
Thank you. And someone is asking also, they said that their mother had COVID-19, and she's wondering if COVID-19 is going to make the Alzheimer's disease worse for her mother, because she's seen that her mother's using the bathroom more often and crying more often. So she's very concerned about that.
Well, you know, there aren't any real studies or data to give an answer to whether it's going to make the Alzheimer's worse. But of course, anything that affects the general well-being of a person is going to kind of magnify the problems they already have. And we already know that, you know, when people have had a virus, COVID or any other virus, there is a lot of post-viral syndrome where you just don't feel right. And feeling depressed is actually one of the known components of that. And as I mentioned, you know, there's a lot of things, feeling weak and tired and loss of appetite. And so all we can do is help that person as well as we can to get their strength back and to keep them engaged as much as possible. But I certainly think that someone with Alzheimer's, we're going to see more apparent that it's affecting them adversely.
Okay, thank you. And I guess kind of on the same lines as that, someone's asking if seniors are prone to long-term COVID symptoms.
I think that in the research we've done, unfortunately for every group, we're seeing these long-term COVID symptoms. We're seeing them in all the age groups. So whether someone has those kinds of prolonged effects or not does not seem to be just age, but certainly older people are prone to it as well. The big risks for older people are the ones, again, that we keep hearing. The risk of a severe bout with COVID and then having a difficult recovery, go with high blood pressure, diabetes, obesity, history of lung problems, and cancer. People have a history of cancer. So those are some of the vulnerable groups. But I would say, even young people, young, vibrant people can have this post-COVID syndrome. So it's not restricted in that way.
Mm-hmm. That's very true. Yeah, so somebody else is asking, apparently they live in a household where multiple people got COVID-19, but her husband, who has dementia, he did not have any symptoms, and she would like for him to be able to get the antibody test, but they're continuing to say that that the test is inconclusive. So what she's trying to figure out, she says, how vital is it to know whether my husband had COVID? Is it wiser to just wait for his turn in line for the vaccine? Is the vaccine even safe for him at the end stage of dementia that he is in?
So if you're in a household with a lot of people with COVID, it is sometimes possible that one or more people will not get COVID, and we don't understand exactly how that happens, if it's because somehow they avoided the exposure or how else they didn't test positive, but that does happen. So if you do want to know if the person has antibodies and therefore may have some immunity and did actually have COVID in that time period, the antibody test, it's not perfect, but it's an indication. If you clearly do an antibody test and see antibodies, then I would be fairly confident that they had been exposed and had COVID asymptomatically. But whether or not they have had COVID, the recommendation is to get the vaccine. There might be an advantage to waiting a little longer to let the body recover if you have had COVID. But vaccination is definitely a good idea. And I would also say, for older people who have the opportunity to get the Johnson & Johnson vaccine, it's only one dose vaccination. So that is an advantage for people with Alzheimer's to not have to put them through 2 doses. But I don't know if when it's going to be approved. They're saying maybe early March. So these are considerations that you need to discuss with your own doctor. So I'm just giving you kind of general information about that.
And someone did ask, I know you just said about if you had COVID, it's good for the body to recover. Somebody is asking about how long you think that somebody should wait to get the vaccine if they had COVID.
So there's a lot of different viewpoints on that. I will tell you mine, but it's an evolving area and things are changing. If you just had COVID and you recovered, I think you need to let your immune system kind of rest. I think the data is very good that you have at least 3 months of pretty good protection, probably 6 months. I would say to wait between 3 and 6 months to get vaccinated. And I do want to say some people getting the 2 doses of vaccine, if they've had COVID, they can have a pretty substantial reaction to 1 dose. And then it may be wise not to have the 2nd dose. We're having debates and issues with whether they should or should not have the 2nd dose. So again, my solution to that is, if we get it out there in time, is to have the Johnson & Johnson vaccine that is only 1 dose. But again, this is just my kind of guideline information, and it's a constantly changing field, and I have to change my viewpoints with more information. But as of the knowledge I have right now, that would be my recommendation.
Thank you. And so for people who are homebound and unable to go somewhere to get the vaccine, someone's asking if it's possible for nurses who visit clients in their home, if they're able to give the vaccine.
Well, again, that goes back to the jurisdiction and the health policies of every community, if they can do that or not do that. And I think it seems very reasonable. But again, all these things are up to the people who make these rules.
Okay, and so someone else is asking, how do you explain COVID and the subsequent illnesses to an advanced Alzheimer's patient?
That's a tough question because it really depends on their level of ability to absorb this kind of information. You know, I think it's just something that you say in general terms, that there is a sickness that is out there that people are catching, that it's causes a lot of very unpleasant and difficult symptoms, and that we want to try to make sure you don't catch this. And that kind of is the universal truth of this. We want to prevent you from getting it because it's going to be something very unpleasant and possibly, you know, could affect your life. And so we're going to take every step we can, but we're not going to let it interfere with every aspect of enjoyment of life. We don't want to cause a fear reaction that can only be counterproductive. So it's really a balancing act that I think is best done by the people who know that person well.
And since this is sort of the time that people are getting flu vaccines, I am getting some questions about whether it's safe to get the COVID-19 vaccine on top of the flu vaccine, or whether it's best to wait.
Well, at this point, I think most people have had their flu vaccine. I guess my feeling would be not to do them both together, but we're kind of pretty much past the point of having that happen for most people because they've already had the flu vaccine. So hopefully it's not going to be much of an issue right now.
Thank you. And let's see. So we've have quite a few questions here. I'm trying to figure out which one would be best for next. So if you had the flu vaccine 2 months ago, okay, so that person's asking about the flu vaccine as well. How to help an Alzheimer's patient sleep better? It seems my mother reacted strangely to a sleeping pill. So I guess this is for someone who's having trouble sleeping, and what you might be able to help with on that.
Well, you know, that is really something you take up with your individual physician, because how someone will react to any of these medications is really something you can't always predict until they try them. And so if something isn't working, I think you have to really communicate that to the physician and try to work out other ways. You know, I know sometimes we need pills and medication. I'm not in favor of over medicating anybody. So my perspective is always to do our best to do things that aren't medication. But, you know, I recognize that sometimes there is really no other choice. But, you know, some of the things that help people sleep really are being active during the day, being active in daylight, getting exercise and fresh air as much as possible. Really, that kind of demarcates, you know, day from night. You sleep when you are tired from the cycle of activities that you've done, and to restore yourself after that. But obviously with Alzheimer's, there's so much disruption, and with the world the way it is. So we have to cope the best that we can.
And I'm getting a couple questions too about, so people are having a hard time getting the vaccine. There are several areas in the country where people are scheduling their vaccines and then it's being canceled. And so people are wondering if there's, from your perspective, from a physician's perspective, how best to advocate for their loved one and themselves for better vaccine prioritization for people with dementia and their caregivers.
Well, you know, the Alzheimer's Foundation does our best to advocate for that. And it really is, again, so much individual communities and prioritization. And I hear this frustration everywhere. So I know it's kind of, not much help to say it, but persistence and the way things work. Sometimes like vaccine centers open up and they have vaccine and you kind of have to just get right on the list and rush over there. And it requires like a lot of vigilance. And I really do hope we're going to have more community people engaging in helping to bridge the Alzheimer's community into the vaccine availability, because it's not being done efficiently, obviously. So I think these are systemic problems that we just have to navigate the best that we can. And I guess persistence is the key, and frustration is going to be part of this. And I wish I could tell you otherwise.
Thank you very much for that one too. So I am seeing a question about, someone says that they had a bad reaction to, this is about the flu vaccine again. Somebody had a very bad reaction to that vaccine. So they're a bit concerned about getting the COVID-19 vaccine. Do you think that that's something they should be concerned about?
Well, there are some people who have bad reactions to the COVID-19 vaccine. One of the ideas about that is that the polyethylene glycol in this chemical that is in the vaccine may be causing allergy. I mean, there's other things, all the things that are in there could be causing reactions. We don't know, we can't always predict, but I know that all the centers and all the professionals, when they give the vaccine, they watch over you for at least 15 minutes to a half hour to make sure you're okay. I think that if you've had a previous bad reaction and you go in for this vaccine, you need to let the center know that you've had it. And again, if we could give one shot of vaccine rather than two, it would help people with that risk, because people tend to have a worse reaction to the second vaccine. But if you're getting the ones that require the second one, it really is important to get both. But we're really working to resolve this. But again, we're all doing our best, but no one can know and predict everything. So yes, some people will have a bad reaction, and we just have to be prepared and ready to help them. And we need the medical professionals to be aware and to be vigilant. But if you've had a bad reaction to another vaccine, that doesn't mean that you shouldn't have the COVID vaccine. You have to talk again to your medical professional and weigh risks and benefits.
And someone's asking for people of COPD, have there been more cases of COVID-19 among people who have severe COPD?
Well, it's not that they have more cases, it's that their lungs are already not in great shape, and that COVID-19 vaccine goes to the lungs. It affects the lungs. It can cause a pneumonia. It can cause a lot of destruction within the lung. So when the lungs are already not optimal, then the risk of having a very bad bout of COVID-19 is greater, and we need to be acting faster with those people. And I think that the medical community very much recognizes that, and they get a kind of more alert to worrying about their breathing and caring for those patients. We need to be very vigilant.
And someone's asking, they say, have there been any research done tracking nursing home COVID cases? I get many updates about an employee or patient having COVID. How can we advocate for our loved one healthcare, and also the trauma that they may experience with constant testing and isolation?
So I know that there's research being done trying to figure out what's happening in the nursing homes. I don't know how or what we've done as far as resolving it. This is an ongoing situation, but I think we are getting the vaccines to a lot of nursing homes. I can't speak for everyone and everywhere, but obviously it's really important to get the vaccine to nursing homes and to those patients who are just the most vulnerable to this problem. Now, you brought up the issue of testing, and I myself have some concerns about that, because I've had the test myself 3 times, the nasal swab, And one time it was nicely done. The second time was a little uncomfortable. And then the third time was really kind of very uncomfortable. And, you know, when someone goes in with that swab into your nose, they can push it very far. They can really scrape delicate tissue. I think a lot of older people have very delicate nasal tissue, and they can really be harmed by that and be very uncomfortable. Oh, excuse me one moment. I can't talk now. Sorry about that. I can't turn my office phone off. Anyhow, that delicate nasal tissue being repeatedly swabbed can be quite uncomfortable. So one of the things I think that we could do is get a test that's saliva. They seem to be possible, but I'm not seeing a lot of that. And another thing that I think we could do is have people who are specially trained and helpful to do it gently with the older population, because you don't want people to automatically be fearful and upset when they get the test. We need to obviously get the material, but we want to be careful about that.
Yeah, I've gotten tested quite a few times, and most of the time it was extremely uncomfortable. I did get a rapid test once, and they said that they don't have to go as far up the nose with the rapid tests, because that one I found was much less painful. Is that correct?
I've heard that as well, but I think it is really a lot depends on the person who's doing it. I think that they seem to have a different kind of a hand, you know, each person. That seems to be the variable to me, but it may be that the rapid test is a little less. But the best thing really would be a saliva test.
Yeah, absolutely. So someone's saying there is a new strand that came out. How do we know if the vaccines already in effect will be effective with the new strand?
Well, you know, they are watching that vigilantly. So far, you get at least a reasonable amount of protection to the strains that are out there. But the big problem now is that we don't know which new strains are going to keep coming and whether we're going to have to reformulate new vaccines. So this is obviously a very big issue of concern. But for right now, the strains that are circulating, the vaccine gives good to excellent protection.
Yeah, so I'm getting a lot of responses about people getting tested and how horrible of an experience that was for them. We don't have any new questions at this moment. While we're waiting for new questions to come in, is there anything additional that you feel would be helpful to share that we haven't covered yet?
Well, I think you know, you've been asking such excellent questions, and I think that we do need some changes that you've all pointed out, you know, in getting the vaccine everywhere it's needed and getting people protected and minimizing their discomfort and helping with their recovery. And I know that sometimes, you know, when you go home and you think about this, or if you replay it, you may have more questions. So, you know, we can finish up and then come back with more questions later at a later date when you have them. And I did want to just give a few closing remarks. So maybe we could go on to that. We saw the slides. I think you know how to connect now with us, and I hope that you will. But I want to just say a special thank you, because, you know, it does take a village to get this kind of thing out there to you. So many people make it happen, and I want to be sure to say my thanks to them. I want to thank Bert E. Brodsky, AFA founder and board chair, Charles Fuschillo, AFA president and CEO, for just having an Alzheimer's Foundation exist and do the incredible work that it does. I have to thank my people here at NYU Long Island School of Medicine who helped me make that video. Veronica Rodriguez, coordinator of educational informatics, Clely Castilla, the director of the Instructional Design and Innovation Center, and of course, more people here at Alzheimer's Foundation. Sunny Singh, National Special Events Manager. Jennifer Reeder, who's done all this, helping us to coordinate this and ask me the questions and keep things moving. AFA Director of Educational and Social Services, and Chris Schneider, AFA Director of Communications. And I want to thank Jensen, who helped make these slides look so beautiful and helped to get this all running in the background, because my artistic skills are not great, but the slides look good because other people helped. And that little photo of me in the corner with the mask is really just another reminder that right now we still do need to mask and social distance the best that we can. And I'm hoping that we're going to be able to be giving lots of hugs again. We all need those hugs. And, you know, there is some light at the end of the tunnel. So thank you all for listening and for caring.
We do have a few more questions. If you'd like, I can give those to you, or we can ask people to email as well. Whatever you would like to do.
Okay, well, I'll take one or two more and then we'll finish up.
Okay, great. So someone is asking if both of the vaccines have the same ingredients. What is it about the second dose that make people sick?
Okay, well, the Moderna and the Pfizer vaccine, I mean, I don't know every ingredient, but they're essentially equivalent in a lot of ways. They instruct your body to make the spike protein, that is the outer coating protein that gets the virus into your cells. So if you have antibodies to that protein, it will stop the virus from entering your cells. And they are mRNA vaccines, so they work pretty much the same way. The reason that the second dose may cause more reaction is because we've already primed your immune system with the first dose. So that reaction is really showing that your body is responding as it should. I mean, even if you feel some fever, some aches, it does mean that if you see that spike protein, you react to it and you don't like it. And that's actually a good thing.
Okay, thank you. Let's see. So we have quite a few more now. I did an allergy test and was allergic to 38 out of 56 things on the list. Also, I have asthma. Can I still get the COVID vaccine?
Okay, well, you have to talk to the healthcare provider that is overseeing your care to figure out what you need. I mean, some people can still get the vaccine. We just have to have, you know, some medications available if you need them, but you have to discuss that with your doctor.
Okay, thank you. My mom has COVID before. Do we have to wait 3 months to get her vaccine? I know you had mentioned before that you recommend waiting some time for that.
But again, you know, you talk to your doctor and go to your health professional. But in general, if your mother had COVID, then there will be natural immunity from having had the virus.
And then somebody's asking if you have an idea of the timeline on how long the vaccine lasts.
You know, they're trying to figure that out because we have to decide if we have to give yet another dose in another year or 2 years. So I think the jury's still out on that for right now.
Well, I'm getting many thank yous. Many people are thanking you. Getting a lot of people saying that this is an excellent webinar. They're so appreciative of all of this information that you're providing to them.
Well, it really has been my pleasure to do that for all of you. And again, you know, I have to keep updating my information. It's a learning curve for all of us. I don't have all the answers because all the answers aren't there, but we are making a lot of progress. So I'm hopeful for the future. I think the treatments are better. I think that the vaccines are here and more are coming. And I think, you know, we're going to get through this. So I send my good wishes to everybody for good health And I'm sure we'll be doing follow-ups as needed, and I will be answering your questions by email through the AFA. No question will go unanswered. And thank you again.
Thank you so much.